The Himalaya study is a phase 3 trial that tested a new combination of double immunotherapy, the STRIDE regimen, a single priming dose of tremelimumab followed by durvalumab versus sorafenib, and also included a durvalumab single arm tested for non-inferiority versus sorafenib. This trial included patients with unresectable HCC, hepatocellular carcinoma, so patients who are not suitable for local regional therapies, or patients with advanced disease, meaning patients with a metastatic disease. Importantly, in this study, patients with main portal vein thrombosis were not included, but patients with other types of portal vein thrombosis were included. Patients had to have a well-preserved liver function, Child-Pugh class A, and a good performance status 0 or 1 according to the ECOG scale. The upper endoscopy was not required before entering the study. And the primary endpoint of the study was the overall survival, the superiority in terms of overall survival of the STRIDE regimen versus sorafenib, that was at the time of the design of the study, was the standard of care. So the trial was positive, already published. STRIDE is superior in terms of overall survival compared to sorafenib, and durvalumab single agent is non-inferior compared to sorafenib. At ESMO 2024, I presented the overall survival data at 5 years. It's important to mention that Himalaya is the only phase 3 trial in unresectable HCC with a 5-year overall survival data, and these data are quite mature, 82% mature. What was shown in this update is that at 5 years, 19.6%, so almost 20% of the patients were alive in the STRIDE arm versus 9.4% in the sorafenib arm. And the long-term overall survival was not related to the objective response. So this means that even patients with a stable disease may have a long-term survival. Indeed, we also evaluated patients with disease control, so patients with a stable disease or objective response. And in patients with the percentage of patients who with a stable disease alive at 5 years is 28.7%. Versus 12.7% in the sorafenib arm. Again, this is important because different degrees of tumor shrinkage can be associated with a long-term survival. Patients with a higher degree of tumor shrinkage may have a greatest benefit, but also patients with small percentage of tumor shrinkage, let's say less than 30%, so stable disease according to RECIST 1.1, also these patients may have long-term survival. They are included in the 5-year overall survival group of patients. And so this means that to fully capture the efficacy of this regimen, the STRIDE regimen, the conventional response measures like the RECIST 1.1 criteria are not perfectly adequate. So that's the reason why we evaluated the depth of response. Patients with unresectable advanced HCC with well-preserved liver function and no VP4, so no main portal vein thrombosis. We evaluated different baseline characteristics, and there are no specific characteristics associated with the benefit. So all the patients with the who meet the inclusion or exclusion criteria of the trial may benefit from STRIDE, may benefit from the STRIDE regimen, and may have a long survival. Importantly, in the updated analysis at 5 years, we didn't observe any new treatment-related serious adverse events. So this means that even with a longer follow-up, the safety profile of the regimen remain unchanged. There is another combination, that is the combination of nivolumab plus ipilimumab with the usual 4 administration of ipilimumab, the anti-CTLA-4, that was tested in the CheckMate 90W study. This study was presented at ASCO and ESMO 2024. It's not yet published in full, so we have the data, only the presentation data. The trial is positive. there is a benefit in overall survival with the nivolumab plus ipilimumab combination versus sorafenib or lenvatinib, and most of the patients in the control arm received lenvatinib. And so we need more data. We need the full paper, but this will likely be another double immunotherapy option for patients with unresectable HCC. The trial is still open, so we for sure will be looking to further data, longer follow-up, and also other analyses are ongoing. So there will be other publications in the near future to analyze different aspects of the STRIDE regimen in terms of efficacy and safety and long-term survival. What we are doing is to test the STRIDE in some groups of patients who were not included in the Himalaya trial. There is an ongoing phase 3b trial, that is the Sierra trial, that is testing STRIDE in patients with main portal vein thrombosis or Child-Pugh B liver cirrhosis or ECOG performance status 2. So again, in the future, we will have more data about STRIDE also in different patient populations.